Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the anatomy of the adductor canal. The adductor canal is also called substartorial canal, also called Hunter's canal, according to the name of a British anatomist and surgeon, Dr. Hunter. Okay, so we have to know what is adductor canal. The adductor canal is an aponeurotic tunnel in the middle third of the anterolateral on the anterolateral aspect of the thigh. Okay, so you got the definition. This is an aponeurotic tunnel in the middle third of the anterolateral aspect of the thigh, extending from the apex of the femoral triangle to the adductor hiatus. Okay, so we got the definition of the adductor canal is an aponeurotic tunnel. You can call it intramuscular passage in the middle third of the anterolateral aspect of the thigh, extending from the apex of the femoral triangle to the adductor hiatus. Okay, so this extends from the apex of the femoral triangle. This is femoral triangle, and here we have the approximate area of the adductor hiatus. This femoral triangle, we got the muscle here, adductor longus. This is the sartorius muscle. This is the inguinal ligament. So this is the femoral triangle. Okay, and this is the apex of the femoral triangle. From here to the adductor hiatus, the lowest opening of the adductor magnus. Okay, this part underneath the sartorius muscle, we have the adductor canal. So we'll go to the boundaries of the adductor canal. Now we got the definition. Now we'll go to the boundaries. Anteriorly, it is bounded by the vastus medialis. By the vastus medialis. Posteriorly, it is bounded by the adductor adductor longus above and below adductor magnus. Okay, we got the posterior boundary. This is the adductor longus, and this is the adductor canal. This is a triangular intermuscular passage. We can see aponeurotic tunnel here. This is the adductor canal. We got the anterior boundary, we got the posterior boundary. Now medially an aponeurotic fibrous tissue connecting the adductor longus and adductor magnus to the vastus medialis. Okay, so this is the aponeurotic tunnel here connecting the adductor muscle to the vastus medialis, adductor longus or adductor magnus to the vastus medialis, and overlapped by the sartorius. So this is the sartorius muscle, very long muscle extending from the anterior suprailiac spine to the upper part of the medial aspect of the tibia. We got the boundaries of the adductor canal. Now we will get the contents of the adductor canal. Contents. We have the femoral artery and its muscular branches and the descending genicular branch of the femoral artery just above the adductor hiatus. Okay, its muscular branches like this. This is a muscular branch, another muscular branch. This is the descending genicular branch. This is the descending genicular artery. There is a branch of the femoral artery. Okay, muscular branches and descending genicular artery is a branch. Okay, this is the branch of the femoral artery. Then we get the femoral vein. This is the number 2. This is number 1. Number 2 is the femoral vein. Then we get the saphenous nerve. Here we get the saphenous nerve. This is the saphenous nerve. Saphenous nerve is that. This is the saphenous nerve. Okay, that is number 3. Then nerve to the vastus medialis. Nerve to the vastus medialis. Nerve to the vastus medialis. This is the nerve to the vastus medialis. Okay, we got that. Then this is the nerve to the vastus medialis. Okay, nerve to the vastus medialis, to the vastus medialis. Okay, we got that. Number 4, nerve to the vastus medialis. Then we get anterior and posterior division of the obturator nerve, division of the obturator nerve. Okay, here that and these are the division of obturator nerve. One is anterior, another is posterior. Division of obturator nerve. Okay, we got the anterior and posterior division of the obturator nerve. So these are the content of the adductor canal. So femoral artery, here femoral artery, femoral vein, saphenous nerve, nerve to the vastus medialis, anterior posterior division of the obturator nerve. Okay, this is the nerve to the vastus medialis, descending genicular branch of the femoral artery. Okay, so we got the contents of the adductor canal. Okay, we got that. Then we have to know the substarterial plexus. We have plexus here between this sartorius and the aponeurotic connection between the adductor longus and adductor magnus to the vastus medialis muscle. This is the gap between the aponeurosis and the sartorius. This is overlapped by the sartorius, this aponeurosis, and we have the substarterial plexus. Substarterial plexus. Okay, so how it is formed? Substarterial plexus is formed by the contribution from the saphenous nerve, by the medial cutaneous nerve of the thigh. Okay, medial cutaneous nerve of the thigh. Okay, we got that. Then anterior division of the obturator nerve. Obturator nerve. Okay, we got the formation of substarterial plexus that will innervate these structures around the substarterial area, and also this will innervate the skin, the aponeurosis and the deep fascia around that. Okay, our saphenous nerve is a sensory nerve. Okay, we got that. And obturator nerve innervates the muscles, the adductor group of muscle. Okay, and this is a cutaneous nerve, medial cutaneous nerve of the thigh. So this is the substarterial plexus. Okay, now we have to know the clinical anatomy of the adductor canal. Okay. Clinical anatomy. what is the clinical significance of the adductor canal? Adductor canal is used to approach to the femoral vessels surgically, okay, to approach to the femoral vessels surgically. Suppose to do a surgery for the popliteal aneurysm or abnormal dilatation in the popliteal artery. So the femoral artery may be ligated. There will be establishment of the genicular anastomosis. Okay, we got that. Now we'll summarize few facts. So these are the contents of the adductor canal: femoral artery, femoral vein, but not the femoral nerve. But the branch of femoral nerve, saphenous nerve, nerve the vastus medialis, are content of the adductor canal. Okay, so we got its extension from the apex of the femoral triangle to the adductor hiatus. Adductor hiatus is the tendinous opening in the lower part of the insertion of the adductor magnus, just above the adductor tubercle of the femur. Okay, and that adductor hiatus transmits the femoral artery, femoral vein, and posterior division of the obturator nerve. The anterior division of the obturator nerve will go to contribute in the formation of the substarterial plexus, and the descending branch of the descending genicular artery branch of the femoral artery has one branch called saphenous artery. Another is the deep muscular branch that passes within the vastus medialis, okay, and contribute in the genicular anastomosis. Okay, and that's all about the adductor canal. If you like my video, please support my channel. Please subscribe me and share the information with your friends. Have a nice day. Bye now.